Assalamu alaikum. This presentation is on a family of sutures, the vertical mattress sutures. They share few features, like they are all formed of two loops of suture lines rather than just one loop as in the case of the interrupted simple sutures. They also have their orientation in a vertical line. The 4 points of penetration into the surface is in a vertical line perpendicular to the wound edge. That's why they're called vertical mattress sutures. But they differ in few aspects. They differ in the way they either evert or invert the wound, the way they disperse the tension on the wound, and the precision and the opposition of the skin edges. We'll go through 6 of the vertical mattress sutures in this presentation. Sutures are developed to provide 3 main functions. They relieve the wound tension while the wound is healing. They also provide precise opposition of the skin edges, point-to-point position. And some sutures can evert the wound and some sutures can invert the healing wound. In the vertical mattress sutures, it's formed of 2 loops of sutures passed in within the tissues being sutured. 4 points of penetration into the surface. 2 of them are far points and the other 2 are near points. But they differ. Sometimes it's a far to far and then near to near, like in this example, or it can be far to near and then far to another near, or it can be near to near, or it can be inverted. So they differ, but the basic structure would remain the same. 2 loops, one of them is the near to near loop, which is a shallow through the dermis itself, and the other is a deeper loop into the subcutaneous tissue to provide tension support to the wound edges while it's being healed. And there are 6 common versions of this family of mattress sutures that we're going to discuss in this presentation. 2 of them would be the far and near to near sutures, another near to near and a far to far, and a fourth far to near, near to far, and then the Lembert suture and the Halsted sutures. And we'll see their individual properties and how some of them would give eversion to the wound edge, some will give inversion, and some would provide more tension dispersion than others. There will be 4 points of penetration to the surface and for the vertical mattress sutures. 2 of these points are the near points and the other 2 are the far points. And generally speaking, as an oversimplification, the 2 near points will be placed 2 millimeters away from the skin edge either side, and the far points will be between 6 and 8 millimeters again either side. But this would vary between one member of the family and the other, and also varies according to the wound itself. It's a contaminated or an infected wound, or if the patient is diabetic, elderly, or had previous radiotherapy, the dimensions are going to change. But this just serves as a simple rule to remember. We start placing the dots of ink. In the simple interrupted suture, we usually place them about 4 millimeters away from the skin edge, like in this example. And then place the other wound about 8 millimeters, the other suture about 8 millimeters away from the first one. When we're doing the vertical mattress sutures, the near to near would be 2 millimeters from the skin edge, and the far to far would be about 6 to 8 millimeters from the skin edge. And the near sutures would pass through the dermis, and the far to far sutures would pass through the subcutaneous tissues. Now we start with the first member of the family, the far to far and the near to near And these are the classic versions, but there are two versions of these classic ones. This one is the very traditional type. You take the suture from the far point on one side to the far point on the other side, and then you change the needle direction and pass it through the near to near on the same side first and then the other side. So you end up with the two strands on one side, and then you tie the knot on this side. There is another version of the far near suture. This is the other version. You take a far to far first, and then rather than doing the near on the same side, you do the near on the other side, again through the dermis. And then you have the strands, one on each side of the wound edge. Once you have the near to this side and the far to the other side, this will be the two strands, and this is the two loops of the suture, and you tie the knot. And this gives a little bit better dispersion of the wound tension, because you are not tying on the same side with the two strands on the same side. You have one strand on one side and the other strand on the other side, so it gives a little bit better dispersion of the wound tension. And this is the third member of the family, the near to near and then far to far. So you do the near to near first and then do the far to far at the end. And it's meant to provide better precision in the wound edge opposition, particularly in exposed areas when opposition, perfect opposition and precision is of prime importance. This is how you do it. You start with the near to near through the dermis, and then you change the direction of the wound and do the far to far as the second step. And then you tie with the two ends of the strand on the same side of the wound edge. One of the important functions for a suture is to provide either wound eversion or wound inversion if one of the two is required in a particular situation. Usually in exposed wounds, you would want a little bit of wound edge eversion, as scar tissue that can form to provide healing of the wound can cause a little bit of depression of the wound. So if you have it like everted, this will compensate for the inevitable depression of the wound during the healing. This is provided because you have two loops here. One of them is smaller and more superficial, and the other is longer and deep, and this configuration allows for the wound edge to evert. The three examples that we had so far for the far, near, or the near, far, all provides skin edge eversion. As you see, when we are tying the knot here, there will be a little bit of skin edge eversion. But if you wanted the other way around, if you want inversion, then you just have to reverse the configuration of the vertical mattress. You have the smaller loop underneath towards the deeper side, and have the longer one more superficial, and this will cause inversion of the wound, like we'll see in the last two examples, the Halsted and the Lembert sutures. If you have your loops reversed, then once you tie, when you start tying in the wound, you see that the skin edges are actually going to invert rather than evert. As you can see here, when we're tightening it, the skin edges now invert. The fourth member of the vertical mattress family was developed to provide better tension dispersion in the wound in situations where you have, for example, the wound is a little bit inflamed or you are suturing fascia under tension. If you want to disperse the tension of the wound in a better way, this is the suture to consider using. And this time it's far to near and then near to far. And you can have two versions of this. You can start by the far one here, go to the far one there, and then rather than going to the near, you go to the near on the other side, and then near to the opposite side, and then you suture your knot here, and you have your sutures, one suture strands from the two sides of the wound, one from this side and the other from the other side. The other version, which is more commonly applied, is this. Again, you start on the far end here, but you don't go to the far end there, you just go to the near end on this side, and then to the near end on the other side. You end up with the far side on the opposite side, and then you tie your knot. And this configuration provides better dispersion of the wound tension that's sometimes required if you are suturing things like fascia, tendons, or muscles, or if the wound is a little bit inflamed, or if there is a bigger gap, or you want the wound, if you expect the wound tension to be a little bit higher than usual. So this is how you can do the fourth version of the vertical mattress sutures, the far near, near far vertical mattress, sometimes called the Smead-Jones suture. You alternate between far and near points of penetration. This provides greater mechanical strength to the suture, and it's particularly required if in patients who have a risk of facial disruption or infection if the wound tension is a bit higher. You start from the far on one side, go to the near on the other side, then the near on the initial side, and end up on the far on the opposite side. You have the two ends of the strands on opposite sides of the wound, and then you tie the knot, and this disperses tension in a better way. And as you can see here, you start from the far on one side, go to the near on the opposite side, and then you change the direction, go to the near on the initial side, and end up with the far on the opposite side. So again, you would have the two ends on opposite sides of the wound edges, and this loop will interlock with the other loop. So you have interlocking two loops rather than parallel loops, and this provides better mechanical strength to the wound itself. This is when it's being tied. The next two members of the family of the vertical mattress sutures are the number 5 version, the Lembert suture, and the number 6, the Halsted suture, and both provide inversion of the wound edge. This is required if you are repairing or suturing into hollow viscera, like for example if you're doing a pharyngoplasty or working into an intestine or stomach. You want the wound to invert towards the inside of the viscera. On this side, this will be the mucosa here, and this will be the inside of the viscera, and this will be the outside. And the way this is produced is you have two loops of the suture, the smaller loop here, the near to near, and the larger loop the far to far, and the smaller loop will be underneath and deeper to the bigger loop, so this is going to cause inversion of the wound edge. And in the Lembert, you start with the far, loop it inside in the wall of the viscera, but through the submucosa, but don't penetrate the mucosal layer itself to avoid contamination of the suture line. Then pass it to the near of the other side, then to the far, and tie it over, and this is going to cause inversion of the wound. And the Halsted is a modified Lembert in that you do the Lembert first, and then rather than tying it, you do another suture on beside it. So you have actually a combination of a vertical mattress and a horizontal mattress together, and that provide better tension support to the wound and better inversion. So this is how the Lembert suture is being done. Remember, we are working on the surface of the hollow viscera, and then you do the far to the near, and then near to the far, and now you have two loops, one between the near, that is a smaller loop, and the longer loop between the far and the far on both ends of the suture line. And when these are tightened, the wound start to invert, as you can see. And the other suture, the Halsted, is you start with the same. You start by doing the usual Lembert, the near to the far, and now you don't tie it. You do another Lembert here. So you have two parallel Lemberts in a configuration similar to a horizontal and a vertical mattress combination. And then you don't tie it, you just start the other vertical mattress here. Again, this time on the other and the opposite direction, far to near, and then near to far, and once you have the two ends of the strands on one side now, one from each of the Lembert's part of the suture, and when you tighten this, the whole wound is going to invert and the tension will be dispersed better. That's a bit of an inversion here. So by this we end this presentation on the family of the vertical mattress suture. We proceed with the next presentation with the family of the horizontal mattress sutures. Assalamu alaikum.